Welcome, welcome, caregivers, to episode 2 of the introduction series leading into the Caregiver's Carabiner. And tonight we are talking all about awareness. Awareness. And it sounds like something simple, but I think you're gonna see. You're gonna see maybe easier said than done. Easier said than done. So let's dig right in. Last week, for the first installment in the series, it was like a little meet Aaron intro. And I explained how we came up with, me, myself, and I came up with the name for the Caregiver's Carabiner. If you missed that and you registered, you'll get the replay for that. So you can start off there and then join us here for awareness. So let's put our caregiving hats on. And I want you to let me know if you're here with me live. Thank you for being here. Go ahead and type in the chat. When you think about caregiving, what is it that you think about? Is there one word, one feeling? Okay, love, sacrifice, exhaustion. Yes, I know exhaustion. Yeah. Selflessness. Amazing. Those are all amazing. And they're all correct. There's no wrong answer. I know that some people, or I feel that some people, give caregiving a very narrow definition. Like it's simply driving people to their doctor's appointments or simply filling the pill box. And as a caregiver myself, I know I think about all of the other duties as assigned. Now, I like to kind of compare this to moving because everybody has moved. We've all moved somewhere at some time. There might be maybe one. And actually, I want you to tell me if you have lived you've never moved and you've just lived in your childhood home your entire life and you've never moved anywhere, tell me because I want to hear about it. But if you think about moving and you think about all the little things that you need to do when you move, you can think about how all of those little things start to add up. For example, when you move, you have to turn your water and electric on at the new place, off at the old place. That's usually easy enough. You need to make keys. Maybe you change the locks. You need to figure out where the light switches are in the new house so that you don't run into corners in the middle of the night. And each one of these tasks is very simple, and on their own, they're rather meaningless. But when they're combined with an aching back and not being able to find anything because your stuff is all in a box somewhere, all these little stressors begin to add up. And just like when you're packing a box to move, you have all different size boxes. And you can take one of those really big boxes and you can put all kinds of stuff in there. But if you're not careful, if you put in too much stuff, if you don't use some bubble wrap to protect what's there, if you don't create a good foundation by really taping up the bottom securely, you can put so much in that box that when you try to lift it, the bottom will fall out and the contents will shatter. And as a caregiver, especially when we're dealing with major medical, like a transplant, it's all the other duties as assigned that start filling up that box. Tasks that seem small and insignificant, but if you don't have that bubble wrap and packing peanuts to soften them, they have the potential to take on a life or death significance. And before you realize it, you've started living a trauma every single day. Now, as a caregiver, you're also still responsible for all of your everyday responsibilities. So you're still feeding yourself, you're still going to work, you're bathing, you're cooking the meals. If you've got kids, you're doing all of the kid things, you're paying the bills. And perhaps you already handle all of that part of your life with ease. Maybe not so much. And then in an instant, you become a caregiver. The moment some lovely person in a white coat says, "Didn't they tell you you have cancer?" That's the moment you become a caregiver. You become the chauffeur driving your patient around to appointments. You become the sous nurse, which is like the sous chef. And you help nurses if you're in the hospital just kind of keep things under control. I always did like the little S folds on Jerry's blanket to make sure he could pull them up easy. And we have a whole like cord organization system, the way he likes his like cell phone cords and things like that. You become the unfinancial advisor because the instant you become a caregiver, you're also expected to be an expert on insurance, advanced directives, medical super bills that are like 10 pages long, all written in a language you do not understand. And the most terrifying is the kitchen table pharmacist. Now, when Jerry was in the hospital after his transplant, the pharmacist came up with this big plastic shopping bag filled with prescription bottles, and she was there for pill training. And I wondered to myself, what is there to train exactly? Like, their prescriptions or pills, you take them. But there were like 20 of them, and one of the pills was like $5,000, which it's a completely different story and a completely different stressor. I was like, nobody told us that. And they produced a piece of paper that said, yeah, huh, we did. And you signed it. And I was like, oh. And one by one, she took the bottles out of the bag and set them out. And she taught me how to fill the pillbox. And it was more complicated than I anticipated because, yeah, some pills were once a day in the morning, but some pills were every other day. And some pills couldn't be taken with other pills. So they had to be spread out. And some pills I had to wear gloves to handle because they weren't safe for me. So you might be thinking, okay, Erin, you filled the pillbox and you might be having that experience too with the pillbox. But I know in my experience, I just can't express deeply enough how big a responsibility that was for me. Knowing that those pills kept my husband alive and knowing that if I messed them up, he could die. And so every Sunday morning when I filled that pillbox, that small, seemingly insignificant chore took on a life or death significance for me. And I lived that trauma every single week. And nobody prepared me for it. Now, whew, the thought just left. So the examples I've given you are really based in major medical, but there's another side to caregiving, and it's a much more personal side because life doesn't stop for caregiving. And I would imagine if you're in a long-term caregiving situation, you might come up against this example a little more personally. This story gets me every time I tell it. So during a good portion of Jerry's care, we were both self-employed. And that offers some wonderful benefits, like it gave me the flexibility to be able to care for him without me having to ask anybody for permission. And it also offered some challenges in financial and logistical and emotional ways. So during the time we lived in Texas, now it was in Texas, if you remember from last week, where he had his liver resection, where they removed a third of his liver that had cancer. And the hope was he would survive with the remaining portion of his liver and not need a liver transplant, which you know by now was not the case. But at the time, post liver resection, that was the first major surgery that we went through together. And yes, they removed the cancer, but he was still left with a sick cirrhotic liver. So his recovery took a long time, months. And at the time we owned an apartment complex and we worked there full time. I worked in the office doing the day-to-day operation. Jerry had like an apartment office upstairs and he could, look out the window and it's like his little watchtower. He could see everything that was going on. And so every day I would drive us from home to the apartments. I would get him set up in the apartments. I would go downstairs, I would work. I would come back upstairs, I would give him his medicine. I would go back downstairs and work. I would come back upstairs and I would make him lunch. I would like all day, up and down, all day. And this went on for months because he just wasn't well and he needed that level of one-on-one care. So months into this, we're sitting at home. It's a Sunday morning and I have made us breakfast. He's pretty much zonked out in his recliner. I've climbed onto the couch. The cats have snuggled in next to me. I turned on a movie. Like I knew I wasn't going to watch it, but I was going to pretend. And as much as somebody who had had their abdomen all cut open can jump out of a chair, he jumped out of his chair and he said, Erin, we have to go to the apartments. And I'm exhausted, like beyond exhausted. I'm just completely depleted. There's like nothing left to me. And it is Sunday. And we had been there on Friday. We were going to be back there on Monday. And I'm thinking, like, why? What good reason could you possibly have to go there on a Sunday? And so when I questioned him, that was the tone with which I did it. I was like, why? And he got really defensive and really angry. And he said, because I haven't been there since the surgery and I have no idea what's going on. And you guys, in in that moment, my heart crumbled. I don't I don't know that I will ever forget it. My whole spirit broke. I just felt my whole body like collapse onto itself. And I can feel it all right now. I can feel it in my arms going limp just with the memory because he didn't remember any of it. He had no idea that I had been driving him back and forth. He didn't know the work I was doing. Like he was dictating notices to me because he would walk around with his cane. He looked like the emperor from the Empire Strikes Back, just this terrible gray complexion. And it was February. Was it February? No, December. It was December. But by this, yeah, it was winter. So he'd have his hoodie and his coat and his cane. He looked terrible. He looked like death warmed over, but he was walking around engaging in conversation. I had no idea that he didn't know. And so when he came to me and said he had no recollection of everything I had been doing for him and for our family and for our business, it crushed me. And it's these moments outside the hospitals that are separate from the diagnoses, distanced from the tasks. It's these emotional moments that leave your heart broken, that make you wonder why you're there, why it's happening, what it's all for. It's these moments that the doctors don't see. And it's these moments caregivers don't talk about. And these are the moments that make the bottoms fall out of the boxes. So now we get to talk about what caregiver burnout is. Now, I would venture to say that I just gave you a pretty good example of what it was in that last story. Now, Cleveland Clinic describes on their website as a state of physical, emotional, and mental exhaustion that can happen when you dedicate time and energy to manage the health and safety of someone else. So I'm going to repeat that. Manage the health and safety That's big. It doesn't say time and energy to drive people around. You're managing the health and safety of another human being. And I feel like society as a whole undervalues the weight that a caregiver takes on. And many times it is the caregiver who is literally keeping someone alive. And I would like you to just stick with me and think about this. If you were not there as a caregiver, could your person survive? And I'm not talking about can someone else step in and do it, like, oh, there'd be someone, they'd be fine. No, I'm can they live independently on their own? Example, after Jerry's transplant, there is no way he could have fended for himself during that recovery. He could not have done his own medication. He couldn't move around solidly, securely by himself. If he needed help, I don't know how he would have called. He needed someone. And that is why medical centers require transplant patients to have a caregiver and not just one. Most of them require there to be two people listed. And there is a reason for that. And so to acknowledge what we are actually taking on, because I know personally it was like, ah, anybody could do this. It's what we do for family. It just all of the stories that we tell ourselves, it's a big deal. You are managing the health and safety of another human being. Now, Cleveland Clinic also expands their description to say that caregivers who experience burnout may feel tired, stressed, withdrawn, anxious, and depressed. So that burnout, all of those descriptions, they're physical and mental. They're both that burnout. And so here you are, you're doing all of the things that you are supposed to do because that's what our wedding vows say in sickness and in health. But man, it is hard to know what that's going to actually feel like when you're standing at a very pretty altar with flowers and cake. Because no one talks about what caregiving is like. And so, how are we ever supposed to know? And now, I don't say that to make any kind of implication that I wouldn't do it again. I would absolutely do it again. I'd do it 100 times over. I don't second guess any of my choices. What I wish I had done differently was I wish I had taken care of myself differently. I wish I had more information. I wish I asked for more help. I wish I explored some other areas outside of medication and talk therapy. I think it would have helped both my journey and my recovery because you're just moving along and you're doing your thing and you're taking on all these other tasks. You got that box getting a little heavy, heavier, heavier, heavier. And then one day you just don't want to wash your hair and you realize you've stopped exercising. Maybe you don't really realize it. You just have. And you used to make yourself like you did meal planning and shopping and had nice healthy lunches. Now that peanut butter is looking pretty good. And you're feeling depleted, detached, and you just can't think straight. You have that caregiver brain, which is a very real thing. We are going to talk about caregiver brain in the carabiner. And I understand all of those things because that's the way I lived for years. And for years, I was treated for my anxiety and depression with the medication and talk therapy. But in hindsight, I love hindsight. I believe it was caregiver burnout. And because I basically left it untreated, I ignored it, it led to a deeper seated trauma and PTSD. So could it have been easier? I believe with my whole heart, yes. Do I think it was anybody else's fault? No. I do feel some of my therapists maybe could have talked to me about the trauma. Maybe they could have given me some other choices, different tools in addition to medication and talk therapy, but they may not have known. I may not have communicated what I was experiencing, what I was feeling, because I wasn't aware. I wasn't, I was not aware. I was dissociated. I was not of my body. I was somewhere else, going through the motions, going through the motions, avoiding the trauma, avoiding the pain, avoiding the fear, avoiding all of it. But because I did that, the burnout was adhering to me. It was sticking. And that's what I was missing. I was missing the awareness. I was missing the awareness, that gateway to relieving the burnout and preventing that trauma from sticking. So let's talk about awareness now. So stepping into awareness is really beginning to understand where we are right now. Because that whole life you had planned, that you dreamed of, that you saved for, that life changed. It changed without your knowledge or consent. It just happened. And you stepped into a new role as a caregiver. And awareness involves a level of being present, an acknowledgement and understanding of what is happening to you, around you, and perhaps when it feels safe, because it, like I said, none of it felt safe to me. I dissociated completely, so I didn't feel safe. And so perhaps when you're in a place that you can feel safe in that awareness, you can introduce an element of acceptance. And perhaps it can be a place where you can consider things that you've never considered before. So now I'd like to talk a little bit about awareness versus being present versus being grounded, because people might use those terms synonymously. Is that the word I want? Interchangeably. Let's go with that. But I look at them a little bit differently. So being present, yes, is we are present here together. You are here with me. We are here right now in this space. We are not future planning, and we are not thinking about the past. We are not, oh, if I had only, if I said, what if we had done. We're not there, and we're not worrying about the future. We're right here now. Being grounded, to me, has a literal sensation of being connected to the earth. You're not floating outside yourself. You're not feeling flighty. You're not dissociated, and you're not all up in your head. You are grounded. And the reason it's different to me from being present, because you can be present and still feel up in your head, and you can learn to have the awareness and go, I'm all up in my head today, not grounded. And so that's the difference. You can be present and still be ungrounded. Now, awareness adds a little something extra. To me, it adds this element of curiosity. So, yes, you have the component of being present. Again, not in the past, not thinking about the future. You're here now. But once you get here, you get to ask yourself, you can say, okay, I'm here. What else? Maybe you do think, feeling scatterbrained today. And then you get to say, what else? I'm hungry. What else? I have 100 things to do. The to-do list. And maybe you start to go. You get to come back to being present, and you get to say, what else? And maybe as you go a little bit deeper, you have a thought like, I wish I could rest. What else? And maybe you start to feel a little something start to gurgle, tighten your stomach or your chest. You think, I'm feeling mad that I can't rest right now. What else? Oof. Okay, so I feel guilty that I feel mad that I can't rest because we're going to talk about feelings next week. We get to feel more than one thing at a time. It's crazy. What else? Ooh, I feel that heaviness in my chest. Feel that guilt right there. And we get to take this awareness through the entire process. We get to then take it through movement, which we're going to talk about in week 3, and we get to hopefully replace it with something that fills our cup. And so maybe you also, in the space of awareness, get to get curious about things you never thought about before. I'm going to go back to the trauma. No one told me that caregiving could be a traumatic event. It was something completely new for me to consider. No one told me that empathy could lead to codependency. And the caring of somebody, back to the pill box, I filled that pill box, I'm going to say for years. So that empathy and caring for my husband became a codependent behavior because he recovered from his transplant. He was fine. He went back to work, and I was still filling his pillbox. He didn't he didn't expect me to. He didn't say, "Erin, you got to fill my pillbox." There was none of that. But it's this codependent behavior that I was going to say I had adapted, but the truth is I was already very codependent. So the caregiving situation just amplified my codependent issues, which I have been working on healing. So yay for me. And I got to hand that task back to my husband, and he is in charge of his own pills because he is a capable human being. But nobody told me. Nobody told me. And because I lacked awareness of what I was truly experiencing, my entire recovery just took much longer than I feel it could have. And I'm still walking that path of recovery and healing from the PTSD and the trauma. Because acknowledging where we are with honesty and grace, it can just be the most challenging aspect of our journey. And the more we run around, scroll, make to-do lists, the more we are avoiding what's happening inside. When we can't feel it, we can't process it. So when we're avoiding it, we're not feeling it. When we're avoiding it, we're not processing it. When we are avoiding, we are not aware. And that is when we get burnt out. And that is when the trauma takes residence in our bodies. And that is why awareness is the gateway to avoiding burnout. It's the gateway to maintaining that sliver of autonomy. It's the gateway to keeping that trauma from sticking. So, how do we begin to become more aware? Because this is not a simple undertaking. It's not easy. And if you're anything like me, I already talked about how adept I became at dissociating. It was really to the point where I was so unaware and lacked so many coping skills that if I just became uncomfortable, I would dissociate. I would just physically be there, but mentally I was gone. There was nothing there. And that's how my body learned to protect itself. It's the only thing that my body felt it could do to stay safe. It isn't particularly healthy. And if you're not used to talking about these things, getting started can feel really uncomfortable in like an itchy, twitchy, just super scary kind of way. And so I am not asking you to like cannonball into the deep end of the pool on this. We are taking it slow. We are like dipping our big toe into the baby pool, and it's like your own baby pool. There's nobody else's pee pee in it. It's your own baby pool, and you get to dip your toe in and wade in. Maybe you get your wrists a little wet. Like you are acclimating yourself, you are tempering yourself in because it takes practice and it can feel scary. And frankly, you're already taking on a lot as a caregiver. You're already functioning from a space of survival. And so trying to undergo some massive personal development change, that does not feel feasible to me. And so what we're trying to do is learn some of the tools so we can begin to practice them. We can begin to integrate them so that our burnout doesn't take us over, so that the trauma doesn't stick, so that our recovery is smoother and hopefully it's shorter. Now, in the Caregiver's Carabiner, we are going to be going through my workshop together, taking the pause, redefining self care. Because I don't feel like self care has to be big. I don't think it has to be expensive. I don't think it has to be extravagant. And we can take small pauses that really shift our perspective and help bring us back into that place of self awareness. So now we're going to do a little exercise together. And before we get started, I would like you to make a note of how you're feeling right now. You can think about it, you can write it. I just want you to come back to me. Come back to me here. It's going to be okay. And I'd like you to scan your body. Just start at your head, working through your head, through your eyes, ears, neck, throat. And as you work your way down, I just want you to notice. I don't want you to change anything. I just want you to notice. Are you feeling tension anywhere? What is your breathing doing? Are you shallow breathing? Again, you don't need to change it. I just want you to notice it because we're playing with that awareness. We're just being aware. Is there anything else? Maybe you're feeling a little bit anxious about this conversation and what I'm going to have you do and where it's going and all of those things. And I would like you to take just a minute to think about scale from 1 to 10 and how uncomfortable you are, how tense you are. Where are you on the scale? 10 being like just unbearable, crawl out of your skin. I like ick. And 1 is like Zen chill. Okay. So just think about where you are. No judgment. Doesn't, it matters, but it doesn't matter. I just want you to be aware of where you are. That's all I'm asking. You don't need to change it. You don't need to judge it. Just be aware. And now with that information, I want you to get comfortable. So when I say comfortable, I mean actually comfortable. If you're laying down and watching the replay, you can stay laying down. If your feet are on the ground, amazing. If not, they don't have to be. I just want you to be truly comfortable. And I'm going to have you close your eyes. I promise you're not going to miss anything. And I'm going to have you take a deep breath in through your nose. And I'm going to ask you to hold it. And I'm going to ask you to take a little more sip, a little more air in, and exhale. We're going to do it again. And this time when you exhale, I want you to exhale big, like audibly, loud. If you want to stick your tongue out, you can. You don't have to, but I want to hear it. So big inhale, hold it, breathe in a little more, fill those lungs, and exhale. Now let your breathing settle. And we're just going to sit here for a few minutes and breathe. All you're thinking about is your breathing, and you're just noticing. And if your mind is driving you a little bit batty, you're welcome to count your breaths. Inhale for 4, hold for 4, and exhale for 8. Let's do that 3 more times. One more. And with your eyes still closed, let's do that scan again. Starting at the top of your head, slowly moving down past your forehead and your eyes. Give your nose a wiggle. Check and see how your throat is feeling. When you get to your shoulders, give them a little rotation, a little movement. Down your arms. Check for any tension. Rotate your wrists. Wiggle your fingers. Go ahead and scan through your chest. Is there any tightness there still? You take a breath. And through your belly. What are the hips up to? We hold a lot of emotion in our hips. I'm going to talk about that more in the movement section in 2 weeks. Scan through your legs, your knees, your ankles. Give the ankles a twist. Scrunch up your toes. Wiggle them. And as you start to open your eyes, as you start to come back, I want you to think of that scale of 1 to 10 again. Do you remember where you started? Were you maybe like an 8? Maybe you went down to a 7. Maybe you went down to a 5. Maybe you started at a 6 and you dropped down to a 2. So this meditation, 5 minutes. It was a 5-minute pause. Something you can do in the grocery store parking lot. Something you can do before bed. Something you can do when you wake up in the morning. Something you can do in the shower. Ooh, that's like extra level because as you breathe through it, you can picture everything going down the drain. It was 5 minutes. 5 minutes to shift you from your 6, 7, 8 down to your 5, 4, 3. And if it was just one, maybe you went from a 9 to an 8. It's okay. You didn't do anything wrong. No one did anything wrong. That's just where you are. And maybe you go, okay, that's the shift I got right now. Maybe you have time for another 5 minutes. Maybe you make a note that you need to do it again at the end of the day. Maybe you know that's where you were today. And when you do it tomorrow, you notice that you've gone from a 9 to a 7. So you notice how the awareness begins to exponentially build. And when you start these exercises, how your body will catch up and take you a little further each time. That's why we get to temper it. We get to temper it because it's going to build on itself. It's beautiful that way. But you feel clearer, calmer, a little less on edge. Maybe like you can sleep. Did you yawn? Sometimes we'll yawn. Get that blood, that circulation going, oxygen. It'll make us yawn. And that, my friends, is the power of awareness. It's the gateway to creating space so we can feel like we can breathe again. And next week, we get to dive into the key. So if awareness is the gateway, feelings are they're the key. They're the key that unlocks kind of everything. And movement's like the magic, like the icing on the cake. So I'm going to leave you tonight. I hope you enjoyed this deeper dive into awareness, the first pillar, the caregiver's carabiner. If you have questions, please reach out to me. Any insights, any ha-has. Ha-has too. I'll take a ha-ha. Ha-ha, aha. You want to share where you are on your journey. If you want to share your scale and what changed for you in that little 5-minute meditation, I would love to hear that. I would love to share that part of the journey with you. So I look forward to connecting with you again next week. Have an amazing evening. And just remember, it's all about love. Have a great night. Don't forget to like, subscribe, and share.